Hello, everybody. Again, this is a session to increase our awareness about, a little bit of talk about awareness of the corona vaccination, corona COVID-19 vaccination in UK. So basically, Pfizer vaccine is already started. It will be stage by stage, will be given to everybody. It needs that more than 90% to take this vaccine so that effectively we can prevent further spread of this virus. So before this is there is information for the recipient provided by the UK NHS and UK government. It is a very good leaflet. You have to read it before you go to take the vaccine. I have taken the vaccine, so I had this leaflet. So also I have some experience how it worked for me. So I want to share it so that you when take it, it feel easier for you. That is the main purpose why I am doing this session as a small little talk. So you please read that before you take it. If you have any question, you can ask the doctor, the nurse, the pharmacist. If any side effect, you can report it also. So first of all, first things that you have to know, what is this vaccine, COVID-19 mRNA vaccine, and what it is used for. Basically, this is vaccine used active immunizations to prevent COVID-19 disease caused by SARS-CoV-2 virus. So it can be given to adults and adolescents from 16 years. Below 16 years is not allowed to give this vaccine. And it triggers the body's natural production of antibodies and stimulates immune cells to protect against COVID-19 disease. So basically, there will be a checklist they will give you when you're going to take the vaccine, because we have seen that some of the person who have allergies to some of the things, this vaccine can cause serious reactions. So you have to tick box those, just like that, whether you have allergy or breathing problem or rash or anything for particular things, you have to let them know. So basically, it is important to check it that whether you have those things. But if you don't know that there is any allergy, it can have allergy, so it is bad, you don't worry, because then they will be taken for this allergy reaction to the emergencies. Warnings and precaution. So basically, you have to tell, because you have any previous vaccinations or any medicine or food, you have any serious allergy, it is better to talk. And of course, if you have any problem following previous application of this vaccine, then also you have to tell that I have previous reactions. Severe illness with high fever, that is, of course, you have to take precaution. However, mild fever like cold, you can take vaccine, that is not a problem. Weakened immune system, that is another thing, or anything that affect you have any condition that affect your immune power, that you have to be cautious, because we have to also telling in this leaflet, you have to be cautious about if you have any bleeding problem, if you bruise easily, or use any medicine to inhibit the blood clotting. So as with any vaccine, this vaccine may not fully protect all those who receive, and basically there is no current data available what will be that problem with the person who has weak immune system, or taking medication, who is taking medication to suppress their immune power, so like steroids, like these things. So these things we don't know, so we have to be cautious about that. And other medicines and COVID-19 vaccine. So if you are taking any using or recently use or might use any other medicine or any particular. I have seen in my tick box there was a column to fill up whether I have taken recently flu vaccine. Maybe that one is important to take, so you have to tell that. Another thing is that pregnancy and breastfeeding, they are currently limited data because it is just recently came out in the market. So whether you are pregnant and breastfeeding, whether it will be safe, we actually don't know. So it is better to avoid become pregnant until 2 months after taking the vaccine. Driving and using machine, so it has no or negligible influence to drive and use machines. So some of the effect that may possible side effect maybe temporarily affect that ability to drive. So basically that if you are not sure that you can drive properly with after the vaccination, it is better to avoid it. So basically this vaccine that contains sodium and potassium, this vaccine contains less than very small potassium and also very small sodium. And how it is given, so I heard it was given, so it is 0.3 ml diluent, and you have to given in the muscle of the upper arm usually. In my case it is left arm because it is my non-dominant arm, so they gave me the upper part of the arm. This is given, and they will give you another injections in about 21 days apart. So this is about that. They will give you in a call or give you a mail, whatever way they will contact you to give that another second dose. Protection may not be effective unless at least 7 days after the second dose. Yeah. So this is you have to know. If you have any questions about any of them, you can anytime discuss that with pharmacists, nurse, doctors. Of course, there is side effect. FD1, it is not that free of side effect. There will be side effect. Most side effects are mild to moderate, and usually within few days it will go away. Pain or fever can be sometimes troublesome. That very common one that affect 1 in 10, that is pain at injection site, tiredness, headache, muscle pain, chills, joint pain, fever. They are very common. And also injection at site can be swelled up, there will be redness, there can be nausea. But very uncommon thing is that feeling very unwell and enlarged lymph node. So this is the list. I have nothing. I have a little bit of pain after giving, but after that I have no single side effect of it. But it varies from person to person, but none of them is that serious that make you unwell. Unless you have serious allergies and other things, they will check it before you enter to take this vaccine. Now if you have any child that side effect, then you in the leaflet there is where you have to report. There is a form and you can use that to report it. So it is a very fragile vaccine. The storing is very quiet, they have to freeze it -80 to -60 degree, and it's really stored in original packet in order to protect from light. Once you are taking and diluted, should be used within 6 hours. It's very, very fragile vaccine. If you cannot use it within 6 hours, have to discard. So it is really very fragile. And other informations you can see that on the vaccine, that what are the things are there, vaccine, what they contain, active substance, what is that, and of course they are all written in this. So vaccine is a off-white to white to off-white solution, and in a multi-dose vial of 5 dose in 2 ml clear vial with a rubber stopper and a flip-off plastic cup with aluminum cell, and pack size is 195 vials. So basically I have seen in my case it was came from Germany and things, it's packed like that. So this is all a little bit about talk about this vaccine. Let's start and try to take it whenever your turn comes. uh, I told that it was very well organized. What they will do, they will tell you what time, where you have to go, um, and you have to go there before. I think it is better to go before that because there is queue. So you go there. They there will be a person front, and they usually give you a forms, information forms, and of course they will this leaflet, and also they will give you fill up if you have any medical condition, allergies, things like that. You have taken vaccine, immune problem, all the things you have to tick box, tick box, tick box, and they will check those tick boxes, and then they will call inside where the vaccination will be given. Usually you will be lying in a relaxed manner in a bed, and it's very quickly one nurse will come to give you the injections, that vaccine. After giving the vaccine, they will take you, after give you some rest there, after that they will take you another room where you have to relax again for some time, um, just 5 to 10 minutes, just to make sure that you are not feeling very unwell or anything happening. After that, you are done. And if there is a little bit of pain, you can take paracetamol, or fever, you can take paracetamol. If you have headache, you can take paracetamol. That's not a problem. But if there is serious breathing trouble or seriously unwell, you have to tell that, and you have to take medical advice immediately. Hopefully it is helpful. If you have any questions anytime, you can write me. I will love to give you answer, and hope we will fight back, and new year will be new hope, and we will together fight against COVID-19 disease with this vaccination. Thank you so much for listening to me. Bye bye.